Good afternoon, everyone. Thank you again for joining us for yet another Tuesday Zoom update on COVID-19 in the state of California. I'm Secretary of Health and Human Services, Mark Ghaly, and it's, as always, a pleasure to be with you. Today, we're going to do a number of things, give you our normal COVID-19 update with the data, talk through a little bit about a great question I received yesterday, the governor received yesterday, about our projections on where we're thinking hospitalizations will be in the state of California, update on some guidances for some important sectors, and then go into our tier announcements as well. And then, as always, we'll take questions at the end. So today, our COVID case numbers are 3,286 reported cases. Our 7-day average, which is up a little bit over the last week. We've been talking to you about those case numbers coming up some, just over 3,000 for the 7-day average. Our total tests and test positivity we're hovering close to 150,000 tests done. And that is, between 125 and 150,000 tests a day for the last many days, signaling that we're well removed from those days where fires and smoke and air quality were hindering our ability to test in California. Our test positivity at 2.6 at the 14-day is tremendous. It's really some of the lowest test positivities that we've seen across the state. And as many of you are seeing, that many states across the nation, and frankly, nations across the globe, are facing new waves of cases. These are, for some, their first real increase in surges, and for many other states, it's their second high case numbers. And we're seeing testing impacts, hospitalizations, and challenges in some of the hospitals around the nation, things that during the summer we certainly faced ourselves here in California, but because of our working together, really, we think came down nicely. And so far, we have not been facing those increases. I think in part because of the blueprint for a safer economy, but also because of the many important things you Californians are doing on a day-to-day basis. Those things that we talked to you about, we'll remind you again at the end of this presentation to wear your mask, keep your distance, wash your hands, stay home when you're sick, and get your flu shot. We must not let our guard down, continue to do those things. We talk about that sector of personal responsibility. We talk about how we can do many things ourselves, within our families, within our communities, to keep spread down. And we encourage Californians to keep doing that so we don't see the slight increases turn into large increases in cases. The slow, stringent focus of the blueprint for a safer economy, continuing to be guided by data and science, sector-based, working with all of our partners across California's economy to make sure that we're taking feedback into account, and then adhering to public health guidelines, supporting, listening to the public health officials in your local communities that are there to give advice and give guidance so that we can get through this all together. Yesterday, we received a great question about something I shared with you at the end of September, which was projections looking at increased case numbers, our hospital status, what transmission patterns look like at that time, that we were estimating that we might see a near doubling, 89% increase in hospitalizations. Thankfully, through our hard work and continued look at cases, our testing, our isolation, our contact tracing work, we have avoided those high projected numbers. But we do show even today with our cases and our hospital trends that we predict a 46% increase a month from now. So down compared to where we were before, but still an area of concern, and why we continue to push the different advice and risk reducing behaviors that we talk about on a continual basis. I'll remind you that these models are publicly available. California was the first to really put together an ensemble of external models to show the forecasts of how we at the state are thinking about where we end up based on today's behaviors, today's numbers a month from now. And that can all be seen at the www.covid19.ca.gov. I invite you, citizen scientists, all concerned citizens, to take a look, see not only what's happening statewide, but you can drill down to your own county level. And these are tools that your county health officials also use to make some of the important local decisions they're making every day. So part of today's updates are long-awaited theme park guidance around live professional sporting events at outdoor stadiums. And then I'll just say it now that based on a number of conversations, are looking at the data and the evidence, that we're moving all personal care services able to resume operations indoors with the stated modifications in Tier 1. That's the purple tier. You'll remember we started out with hair salons, barber shops open in Tier 1. We later added nail salons. And today we're adding things like tattoo parlors, hair removal, and massage businesses. So all of those personal services, as we've categorized them, are now in Tier 1. So before we get into the theme parks and the professional sport guidance, I just want to say a personal note of thanks, I think, on behalf of all of us at the state, working with industry leaders, labor leaders, communities, understanding what the different factors are that go into these and very important businesses, so that we can assure that our guidance is really leading California with science and data. We, as it relates to theme parks, I think many of you know, we sent teams of local or state leaders in public health in our business community to visit with theme park operators to understand what the plans were, how those plans might guide our own decision making, and how we are sure we're doing all we can to keep both employees and visitors at theme parks as safe as possible. We also had the opportunity to send a small team to some of the operating parks in other parts of the nation, and they came back with lots of valuable lessons. Things that we saw that we were very reassured by were really great management of how lines were managed, keeping separate groups apart while in a line, while on a ride. Really great lessons learned there, but also some things that raised some concern. The level of mixing, even without masks, that seemed very random and concerning to us. So those different areas of information were really assimilated and guided where we landed with this guidance. And I just wanted to say that part of what has guided this is this notion that there's higher risk settings and lower risk settings. Over the last many weeks, we've been talking to you about that difference between high risk and low risk settings, the fact that some settings can be modified significantly to reduce risk, and others are harder to modify just by the nature of the activities. So the higher risk settings you'll see here on the left side of the slide, random large scale mixing, really where you can't easily control who passes by who and with or without a mask. The fact that you might have thousands of visitors coming together from a broad geographic area, not just the local community, but from other parts of the nation and sometimes even the globe. People visiting certain settings for a number of days, not just for a few hours, but spending a whole week or a weekend in a community, promoting that might promote mixing and congregating, not just at the activity, but within that community. The fact that many surfaces get touched and handled by a number of different people. And then, as I mentioned just now, that there could be significant impact on surrounding sectors, whether that's the hotel, hospitality industry, restaurants, other retail in the community. People may keep their guard up while they're in, let's say, a theme park, but when they are milling around the community, their guard may go down. And that could be just enough to create outbreaks and transmission risks that California just doesn't want to see. On the lower risk setting side, really, I think about this as controlled mixing, where we can actually work with our business partners to make sure people are coming in and out, staying with their cohort, their household, for example, and not necessarily mixing with many others that they're not used to being around. Again, ability to control not just the absolute number of visitors, but also from where they come from. For example, being able to say, visitors really only from a certain radius or distance, or even from a specific county. These visits are often shorter in duration. We can see somehow in stadiums, for example, having pre-assigned seating that is physically distanced and maintained throughout the entire experience, where concession can be delivered to the row, for example, and it doesn't require you to get up, mix around a concourse or a different part of a venue in order to get food or use the restroom. We also know that some settings have opportunities for fewer touch surfaces, and no small issue, it's easier to do contact tracing and know where somebody was during a specific time or activity or event when you're relying on ticket sales with a specific seat number or section number. So you can imagine if somebody turns positive in a stadium in section 102, we could easily know all the different visitors in that section through the ticket sale platform to make sure that we reach out and do the appropriate level of disease investigation and contact tracing. So these higher risk versus lower risk settings really were an important guiding principle in how we did end up with the guidance that we are putting out today. So for theme parks, we have said, and the governor alluded to this, that we would have a category for smaller theme parks, and these smaller theme parks can resume operations in Tier 3 or orange tier. These will be limited in capacity up to 25% or 500 visitors, whichever is fewer. They can only operate with outdoor attractions, and ticket sales must be limited to visitors in the same county. So some counties with small boardwalk, for example, amusement park venues, visitors from that county, once the county is in orange and public health, local public health has worked with those operators and determined that it is a safe and appropriate thing to do from the state's perspective, can begin those operations for visitors from within the county. For all the other theme parks, the larger theme parks, we are waiting till Tier 4, that's the yellow tier, with a limited capacity of 25%, even in that yellow tier. All theme parks are going to be required to implement reservation systems, so pre-sale of tickets, so we can be sure that individuals are coming, not showing up the day of expecting to buy tickets, that they'll have the ability then to screen guests for symptoms in advance and know again who was in the park when, so potentially as a tool to make contact tracing easier if that is a tool that's needed to track down individuals who were potentially exposed. Face coverings will be mandatory throughout the park unless eating or drinking, a common theme many of you are used to, but really emphasizing it here for theme parks, as obviously the day is full of lots of fun and mixing, but really wanting to emphasize keeping that face covering on throughout most of that experience. Moving now to professional sports and outdoor stadiums, just as I had alluded to, the difference in the random mixing versus controlled mixing, these high risk versus higher versus lower risk environments. We, because of some of these important differences, are allowing for professional sporting events at outdoor stadiums to resume in Tier 3, so orange tier, at 25% operations, and then when a county is in Tier 4, they can move up to 25% operations. Ticket sales will have some restrictions as well for customers within a 120-mile radius to limit the amount of potential mixing and certainly discouraging out-of-state travel or faraway travel for multiple days in order to enjoy a sporting event. Again, advanced ticket sales and assigned seats, no day of or will call ticket sales, eating and drinking in assigned seats only, including concession, stands and not open, but really ordering and delivering food to a row. Face coverings is mandatory throughout the stadium, unless eating or drinking. Also, support coming in and out of the stadium, so we avoid groups mixing together that would otherwise not be seated next to each other. And then prohibiting tailgating and ensuring that parking is at the stadiums and not in parts of the surrounding community. So all of those are, these are all requirements and modifications that we've worked hard both on the theme park side as well as on the professional sporting events with our partners, industry partners, labor partners, to come up with something that we believe at this time really supports the blueprint that we have put out, the slow, stringent approach, and giving us an opportunity to look forward to even more information that certainly could be considered as we continue to modify our approach and consider all the data and information that is made available to us as we increase our experience through COVID-19. So I now want to turn it over to Dr. Erica Pond to come up and share with you a little bit about where we are with our blueprint, the tiering assignments for the week, and a partnership with some Southern California counties to really support a focus on reducing transmission in very important parts of California. Dr. Pond?
Good afternoon. Thank you, everyone. So you've heard a little bit about where we are as a state, and as you know, about our blueprint for a safer economy. We've been making a lot of progress together, and our blueprint really outlines again what are the criteria for loosening or tightening restrictions on activities in our state. Again, as you all know, every county is assigned to a tier based on test positivity, adjusted case rate, and that looks at the number of cases per day per capita or per 100,000 people. And then we've also, as you know, added a health equity metric that we announced early on, and pleased to see how that is helping certain counties move forward. So on that note, just to remind you again, here is the way our scale looks. We have the different tiers, and you learned a little bit about what is changing as far as what's allowed in these tiers, the widespread, substantial, moderate, or minimal tiers, and the different case rates and positivity rates that determine which tier each county can be in. And I'm pleased to share with you today that new counties that have moved from red to orange are Butte County and Napa County. And a new county that is actually benefiting from our health equity metric, San Francisco County, is moving from orange to yellow today. And then there are two counties moving back from red to purple today. So that is Riverside and Shasta. So again, as you've seen from all of our presentations today, we continue to make overall progress as a state with this slow and stringent reopening. And we've managed to move forward and maintain our case stability, even as we've seen again across the nation, as Secretary Ghaly noted. And in doing that, again, we're balancing all of the restrictions and loosening. And we've noted again that there are 3 Southern California counties that are in the widespread purple tier. And we want to continue to do everything we can as a state to work with our partners to move the whole state forward, which includes really focusing next on these 3 counties. We learned a lot of lessons from our focused Central Valley efforts and our Central Valley strike teams. And our state is planning to partner with these counties in several ways to help, again, move them forward, which will help us all as a state move forward. We will increase testing resources in key areas. So we've talked a lot to our partners in these jurisdictions, and we know that there are certain populations that are harder to reach, or it's also really helpful to have, for example, mobile testing resources. So sometimes we don't know where a certain outbreak is going to be or where we see shifts in where disease transmission is, and the counties really need more flexibility in that. So some counties need more mobile testing, and there are other specific things and needs that each county has that we are going to work with them to address. There's also continuing needs for isolation resources. So it's not easy for everybody when they are diagnosed as a case of COVID-19 to be able to isolate themselves from others and be able to have all the food and resources that they need in order to do that safely and remain apart from others. So we'll be working with counties as well to make sure that those isolation resources are available. And really importantly to this pandemic and to moving ourselves forward is partnering with the community-based organizations on the ground. So in order to serve those that are having the most disease and that need all of these resources we just talked about, we really need trusted community partners to be able to work and reach individual cases, talk with those cases about who they might have come in contact with, help reach those contacts as well, and do all of that in a way that allows for trust, allows it to be culturally appropriate. So it's really, again, important to work closely with those community-based organizations and also with community-based leaders to help disseminate a lot of our messages about all of which we're talking to you today around all the prevention measures we can take together. And along those same lines, as far as educating various parts of our community, we also want to work very closely with businesses as well to educate and also enforce. So we're working across the state and our different agencies with our Office of Emergency Services, our businesses, our consumer services and housing agencies, our labor agency, and our California Department of Food and Agriculture. Together, we can really look at where are there areas we could better support employees or employers to help protect their workers and as well as their patrons, and be thinking about all of these issues around how do they get to and from work, how again are we providing resources when people are ill and out from work, how are we making sure they have all the safety and personal protection they need when they're at work? Are they doing everything they can to make sure people are physically distanced in order to also serve their clients? So all of these efforts, we are again pleased to share that we'll be working closely with these 3 Southern California counties to move them forward and help them continue to move California forward. So finally, as we're emphasized over and over again, we can't say it enough. These simple acts can really make a big difference. And these make a big difference for COVID-19 and for flu, and actually all other respiratory viruses too. So as we all remember to wear our masks, maintain at least 6 feet of distance from others, wash your hands, minimize mixing, especially across different communities. And it's really important. We have a huge campaign right now to prevent flu this year. So please, please remember to get your flu vaccine and make sure you and your loved ones do. I have gotten mine and my loved ones have. And really, it's important to protect both yourself and the general community to get your flu vaccine and help prevent flu in our community this winter as well. And with that, I will turn it back over to Secretary Ghaly.
Thank you, Dr. Pan. And I just want to say a note of thanks also to the leaders, public health and elected leaders locally in Riverside, San Bernardino, and Los Angeles County for the partnership. I'm looking forward to what we can do together to address transmission, and as Dr. Pan said, in those focused areas and really help those counties move forward, but also really continue to carry the state forward in the way I know all of you expect us to move forward. And I think the next many weeks will be critical for those counties and us as an entire state. So with that, I want to open it up to questions.
Don Thompson, AP.
Good afternoon. Wanted to check on the theme parks as far as on the number of visitors. Why can't the bigger theme parks also open with the same limits on visitor numbers? Or as you alluded to a little bit, is it the bigger concern about drawing tourists from farther away and the impact on that might have on the transmission and the testing and the tracing? If you could expand on that a bit.
Yeah, Don, you did really answer your own question in large part. It was really the nature of the smaller amusement theme parks is that they're really local activities. They often don't draw from broad communities, and they're almost exclusively outdoors. They don't have as many indoor venues or aspects of being indoors. Even many of the eateries are outdoors. So for all of those reasons, we did set that difference. And as I said during the presentation, that these are places where we are today as we carry through the next many weeks and months, and we learn lessons from what happens in the near future. It may certainly change our approach to the months down the road.
Brady McDonald, Orange County Register.
Hey, Dr. Ghaly. I had a couple theme park questions. First, how did state officials arrive at the dividing line between small and large theme parks? And second, theme parks are concerned they may never be able to reopen because it's unlikely larger counties in California will ever reach the yellow or minimal tier. What's your response to their concerns?
Yeah, I think on the first one, I mean, we did it looking at capacity and the nature of the sort of venues and attraction, and we did pick a capacity limit at 15,000 or fewer. That would be considered the smaller theme parks, and anything larger would be in the other category. In terms of the concern about not reaching yellow, so today, for example, San Francisco County, a large California county, very visible one, lots of different types of communities and neighborhoods, did today reach the yellow tier. They were benefited by the health equity metric. Many of the other large counties with large theme parks could also benefit from the same. I think some of the focused targeted state partnership with LA, San Bernardino, Riverside will certainly help there, and open to supporting other counties in very much the same way. But we are seeing it now that certain larger counties are indeed able to move to yellow, and we do believe that it is possible and that we've constructed a system that could allow it. It will require a lot of work. It will require a lot of vigilance. It will require us to do testing, contact tracing, and support isolation in serious and real ways throughout our communities to make sure that no part of our population is lagging or not sort of enjoying those reduced transmissions. But we believe it's possible, and San Francisco is a great case in point.
Brandon Lewis, PBS San Diego.
Thank you, Dr. Ghaly. Could you give us just some more insight into what is going on in San Diego County and these other counties that have been teetering between red and purple constantly? What's not happening here? What needs to happen? What guidance are you putting forward? And then some health officers have talked about they want a credit for constantly keeping hospital numbers low. Could you address why that's not factored into the rate, please?
Yeah, so on the first one, it's not surprising that we have counties that are sort of on the cusp. They move a little bit forward or deeper into the red tier, and then they have some increase in cases. And certainly in larger urban counties where spread can happen more rapidly because of denser settings, you can see that happen. And we have been in close contact with San Diego in particular over many, many weeks, looking closely at their data, making sure we have it right, making sure they're delivering the right information to us. And you're absolutely right. There's each week we sort of walk in and wonder whether we're going to be, which side of the threshold that we're going to be on. My hope is that as they identify outbreaks, that they're continuing to do a tremendous amount of testing, building up their resources around contact tracing and supportive isolation, that even when we see some of the case numbers up a little now, that it's really just forecasting an ability to do the things to reduce transmission in the weeks to come. But as I've said previously, the blueprint allows us to look at things and loosen and tighten accordingly. And we will do that with San Diego and other counties that are sort of living on a specific threshold on whatever tier, between whichever two tiers. And then could you repeat your second question? I remember it now. It's about the hospitalization numbers. We have heard and had lots of conversation with health officers and frankly, many others about the integration of a hospital preparedness metric. We chose not to use it, although we follow it closely. The governor updates it every single day, not just hospital beds, ICU beds, ventilator capacity. We're working closely and track all of the different staffing issues within both our acute care hospitals and our skilled nursing facilities across the state. So they are absolutely numbers that we track. However, we believe that in order to really forecast where a county is and where they should be on a tiering system, that looking at hospitalizations is too far a lagging indicator. And even though we want to support all of the communities to have enough hospital capacity to take care of not only COVID patients and flu patients, but all the other needs that hospitals thankfully take care of on a day-to-day basis, we know that if the case numbers themselves are going up, we can predict in 3 to 4 weeks that we're going to see hospital increases as well. So using the case numbers and the test positivity, we believe gives us a much clearer view into what the hospital situation is going to be down the road. And that's why we've chosen to use those metrics as opposed to also using a hospital-based metric as we did in the past and as I think many people would like us to consider doing.
Spencer Castillo, Voice of OC.
Hi, Dr. Ghaly. Thanks for taking our questions. Mine is about youth sports. I'm getting a lot of questions from parents just around the state, frankly, on, when, their children might be able to go play soccer or baseball games again. I was just wondering if there's any movement on that front.
Yeah, I mean, you must also be eavesdropping at my house. My kids, all 4 of them ask all the time, when am I going to get to play basketball? What about a tennis tournament? All of these important, life-forming activities for young people. And we're very interested in that. And stay tuned. It's something we're working on now, taking a lot of feedback, just like we did on theme parks and professional sports from a number of the entities that operate youth sports in an organized way throughout the state. Everything from pony and little league to indoor basketball to swimming. So each of them has their own independent story, and we're working hard to get it right and working hard to get it out soon as well.
Ron Lim, Los Angeles Times.
Thanks so much for taking these questions. This is a kind of a complicated idea to articulate. It'd be easier to explain if everything was going badly or if the coronavirus was completely eliminated. So I'm hoping you can explain this idea. Can you talk in more detail about why California is doing better than you expected and compared to the rest of the country, and whether, if you are a betting man, you still expect the pandemic to worsen in California as the weather gets colder? In other words, is your tier system working, or are we just not in a bad spot because the weather is still hot?
Great question. And so I'll just say, you said better than expected. This is what we expected. We expected that the slow and stringent approach will carry us, and that's why we put it in play. And I would say it would be somewhat irresponsible if we didn't expect this to work and really support the public health messaging that we have worked hard across the state to hold on to, driven by data, driven by science, taking the lessons from earlier parts of our response and changing them. I'll remind you that early on we said it takes 2 weeks before we see a change. Now we recognize it's 3 to 4 weeks before the data really tells us what change, what actually happened based on a change. We understand that things like being outdoors is a very important part of our guidance, that limiting opportunities for random mixing. All of these lessons over the last few months have been incorporated into the blueprint. So we're happy with the progress that we've made. But as I said earlier, with every day in COVID, we can see something change, and it can change quickly. So we want Californians to continue to keep their guard up, to be attentive to the local and state public health guidance, and to limit their activities as much as possible. What we see down the road, I really do hope that even though we'll likely see some increase in cases, that it's something that California keeps relatively low, that our hospitals are able to handle the volume with a great deal of success, that we don't experience any of the staffing shortages. But rest assured, we're prepared for any of those scenarios. But I think compared to other parts of the nation and the globe, that our approach is helping us in part now. But I have to give credit to lots and lots of Californians that continue to support and do many of the important things. And I believe that's carrying us through now, unlike some other parts of the nation and the globe that are certainly having a different approach and different experiences than where we are today.
Melanie Woodrow, ABC 7 News.
Thank you so much for taking the question, Dr. Ghaly. There are hundreds, probably thousands of Bay Area college-age students who are studying right now on campuses across the country. Some of those campuses have mandatory COVID-19 weekly testing and others do not. How much of it, or how much I should say rather, of a concern is it when those students start to return to the Bay Area for Thanksgiving break and winter break, the ones that have not necessarily been tested every week, how much of a concern would it be that they might be asymptomatic carriers, and could we see a spike here in cases?
Yeah, I mean, it's an excellent question. We have many, many cases where exactly that story that you mentioned occurs. Somebody who has maybe themselves tried to do a good job, but not a perfect job of sort of staying, avoiding different people and mixing, and then they end up going home, and a young person who's asymptomatic or mildly symptomatic does infect somebody who's either a bit older or has underlying comorbidities or underlying conditions and is at higher risk. And then we see hospitalizations and unfortunately deaths. So it is absolutely a concern. We ask people not to just use testing to give them a sense that everything's all clear. We still need to continue to do the same things that we drive home on this Zoom that the governor shares on a weekly basis, that we really do need to limit our mixing, keep our face covering on, and avoid any of the high risk environments. So if we do end up going home, those young students who may feel fine, that they've done all that they can to keep their own risk of being infected down. Of course, if people are sick or having symptoms themselves, I would caution against going home. I would caution against creating a potential spread in transmission. So I know those are individual decisions between households, but I think very important, and many of our national leaders are raising cautions around that as well as we enter this holiday season. So more to come on that, but certainly an important thing for people to start considering today.
Lori Weisberg, San Diego Union Tribune.
Yeah, hi. I have it's kind of a two-part question, but the impression I get for theme parks, whether it's Disneyland or SeaWorld, which is partially reopened, Legoland, it's really hard to know what that timeline is because we have no way of knowing when we're going to enter the least restricted tier. So we could be the end of this year, it could be sometime next year. We basically have no way of knowing. Is that correct? And number two, regarding SeaWorld, which is open under rules for aquariums and zoos, it too is operating under capacity limits, a reservation system. But the main difference under these guidelines is that it could add rides and attractions, rides to the lineup, which they can't do now. Is that the main difference? So those are my two questions.
Yeah, so the second question first, you're absolutely right. The main difference, there's other small differences, but the main difference is around attractions and some of the capacity rules for specific parts of an operating zoo or museum as they are. For your first part of the question, you're right, we don't have the crystal ball. I don't know when Orange County or San Diego County will indeed enter yellow, but as I said earlier, I think there's lots of work we can do together, both state, local, business leaders, community leaders, individuals, to do what we can to make sure that we reduce transmission throughout our county. And there is a path forward there. We do not know when, but we do know how. And I think we'll continue to put in the hard work to get us there, one county at a time, but across the entire state is our hope.
Patrick Healy, NBC Los Angeles.
Hi, thank you very much, Dr. Ghaly. Wondering if you or Dr. Pond could elaborate on the vision you see for the assistance to the 3 SoCal counties. Will it involve sending in teams of enforcers, basically, to make sure the rules are observed? And will you also try to deal with the contact tracing issues we've had, particularly in LA County, where at times the success rate for contact tracing has been as low as 50%? Thank you.
Yeah, these are really moments for partnership. I've personally been in touch with leaders in all three counties. I know Dr. Pond's team at the Department of Public Health, California Department of Public Health, is working closely with the public health leaders. I'll say the form of support will take many different forms, but really be tailored around the needs identified by our local leaders and public health officials. It may involve increased testing capacity and resources in certain hard-hit communities or industries. It certainly could involve additional support around enforcement of certain higher risk settings and businesses where we know transmission is occurring and occurring at high levels. But we always lead with support on compliance and education as part of that as well. And then, as Dr. Pond mentioned, support of the community-based organizations that really have strong boots on the ground, strong connections to communities, and can support acceptance and understanding of things involved in contact tracing. This won't replace county-based contact tracing in any way. We will continue to support, as we mentioned, the governor mentioned the week before this one in terms of an update on contact tracing, making sure that those state staff that are in those counties continue to support county efforts. And then, of course, making sure that we add bilingual staff and that we can communicate with all individuals. I will also say that a portion of it is going to be around supportive isolation and making sure that counties have the resources they need to ensure that those who are contacted and can be isolated have the resources to do that, whether that's the need for a hotel, food support, other hygiene, or things like a separation curtain or whatever it takes to make sure that we limit transmission. The state is committed to working with all three of those counties to do what we can to increase efforts to reduce transmission. And we hope see those counties not just come down in the purple tier, but move into the red tier so both businesses and schools have a chance to consider reopening.
Matt Hoffman, KPBS.
Hi, Dr. Ghaly. You're talking earlier about counties that are walking that threshold. First, I was looking at some of the new data, and it appears that San Diego County has had a week of purple tier data, a 7.1 on that adjusted case rate. Can you confirm that? And are you concerned at all about transmission in San Diego County? I know just county officials last week held a news conference talking about data that they had that's going to be included in next week's Tuesday report that they were saying is concerning. Are you concerned at all about transmission rates there?
Again, the second part of your question first, absolutely. We're concerned when we see transmission just about anywhere. And we know San Diego does a tremendous job of tracking where their transmission is. In fact, they have pretty incredible information about where outbreaks are occurring. And certainly that sort of knowledge allows them to have early warning flags about where they would target their interventions. So in some ways, the notes of caution that San Diego is able to provide to their residents is really, a fantastic tool in controlling transmission and being able to communicate clearly as to where the county is. We did, just to your first part of your question, the adjusted case rate actually has been adjusted down. They did meet thresholds, so they do not have 1 week in the purple tier. Although, as I said, they're hovering between that sort of fine line, and we're working closely with them to make sure that the data is right and any additional guidance or support that the state can provide to make sure that they stay on the red side of that threshold, because that tells us that transmission rates are not going up but coming down and stabilizing in that very large and important California county.
Angela Hart, Kaiser Health News.
Thank you, Secretary Ghaly. Schools across the state are making decisions and going back into classrooms, while others, are more inclined to wait until January. So I just wanted to ask you if you think it's wise from a public health perspective that schools are going back now, just as we head into the
depths of this twindemic, as people are calling it, with flu season and the cold season coming, is it wise for kids to be going back into classrooms right now? If you could walk through your thoughts on that, that would be helpful.
Yeah, I think it's an excellent question, and really a question that's being asked county by county, district by district. And in some ways, the right answer is to say, when the conditions in the county meet the thresholds, and we believe we have the right ones of stably in the red tier, that considering some in-person education is a safe thing, but also making sure that schools are in partnership with their local health authorities and personnel to make sure that when they do see somebody with symptoms that could be COVID, that they know what to do, that when they do identify a case in a student or a staff member in the school, that they know what to do, that they have all of the tools there, because there will no doubt be cases in a school. Whether it occurred at that school or not is an open question and worth investigation, and we want to have the tools there to investigate. But to put the tools available, and the state's committed to working with our local education and public health partners to make sure those tools are available, we believe that schools can make the decision even now to bring kids back in-person education, and believe that it's important that those conversations occur at the right time, and that any questions about, well, would this resource make a difference? Would this rule or procedure make a difference? That we ask all of those important questions so we have thoughtful return of students and staff in-person education. And certainly as a goal, it's many of you know that both Dr. Pan and I are pediatricians. We care deeply about educating our young people, making sure that California's future is secured, but while we ensure that staff and other personnel at the schools are indeed safe, and that we've done all we can to mitigate risk, and then the environment around the school is stable enough and low enough with transmission that it can be safe. That said, if the decision is held to wait a little longer to see what happens in the next few weeks, certainly that's a local decision, and we're willing to partake in all of those conversations. So our 2 cents, our advice is at least incorporated if that's what the local districts want.
Barbara Feder-Ostra, Cal Matters.
Hi, thank you. Theme parks are typically regulated by a variety of state and local agencies. As they start to reopen, who will monitor them to make sure they're following the guidelines? And what would trigger a park closure after reopening?
So certainly, all of the same regulations and procedures, both, workplace, food, other things are all in place and will continue to be the responsibility of the theme park to abide with, and regular inspections will occur. We will also ensure that our public health teams and the local public health teams have access to the parks to ensure that there are no material violations of the modifications that we've put forward as part of our guidance. And if through the normal process and conversation and working together, we're not able to meet the needs or ensure that things are done in a safe and satisfactory way following the public health guidance, there will be standard or typical enforcement conversations, and potentially things that lead to partial or complete closures. And then I'll remind you that the county transmission also will be an important part to follow, and that a theme park that might open, if there is widespread transmission in that county again, along with other business sectors, there may be the request for that county that was once in yellow to move back in a tier, and it would have an impact on theme park operations.
Tim Sheehan, Fresno B.
Thank you, Secretary Ghaly. I appreciate you taking our call. Earlier, you mentioned guidance for allowing limited numbers of spectators at professional sports. My question deals with collegiate sports, since we have the Pac-10 and Mountain West conferences both planning to return to football this fall. What sort of guidance is there for college football in outdoor stadiums?
Yeah, at this time, we're really starting with the professional sports venues. We are certainly going to look at the experience here, understanding how to use this new guidance to inform future guidances. But at the moment, we don't have current plans to release guidance for spectators at collegiate or other types of sporting venues.
Final question, Carla Hall, Los Angeles Times.
Hi, Dr. Ghaly. You mentioned that personal services are moving into Tier 1. And given that Tier 1 seems limited to what are considered essential services, what is the rationale behind now allowing hair removal and tattooing?
Sure. Again, these are all parts of often small, operated, well-controlled environments where modifications can be put in place that really do reduce risk. And when we look at the totality of that sector, we did feel after numerous conversations and discussions about even additional modifications, additional barriers, additional security that we know who's in and out and protections for both workers and patrons, that all of those services could be just like hair, just like nails, could be part of Tier 1. So that was the rationale, a decision that, of course, we didn't make right away. We're now in week 7 of our new blueprint. So we did listen thoughtfully, look at the data and information, and decided to make this move now. So with that, I know it was the last question, quite a few to get through, but really a privilege to have a chance to answer and update both our colleagues at the press and all of California on where we are with COVID. I look forward to the ongoing conversations next week. Exciting announcement by the governor on our expanded testing partnership, a large state lab that will help us increase one of the most important tools, but not the only tool, but a very important tool with testing in our COVID response, and a chance to update you further. And as always, I wish you a safe and happy afternoon.